Thank you, sir. Good evening to all. Thank you, organizers, for this wonderful opportunity. So I'm going to present a very interesting abstract. This is the 5285 molecular targets in salivary gland cancers, a comprehensive genomic analysis of 1,660 cases. So this is the disclosures from the presenters. So coming to the background of basically salivary gland cancers, these are rare but very diverse group of cancers in the head and neck subdomain. There are wide varieties of histological subtypes and genomic alterations, and it could range anywhere from a very benign tumor, a low-grade tumor that requires only surgery and no adjuvant treatment, to high-grade cancers and tumors with high-risk features which require subsequent adjuvant radiation therapy as well. When it comes to metastatic disease or advanced disease which are not potentially curable, and these patients can be observed or considered for systemic or local therapies based upon the tumor and patient characteristics. And when we look at advanced disease that potentially looking at systemic therapy as an option, I think most of the solid tumors are moving in the direction of precision medicine, looking at the next generation sequencing and trying to identify a potential target. And this was the main objective of
Support team, please take care. Dr. Pinnati is not audible to everyone.
Yes, sir, we are connecting, sir.
I think the power is suddenly power off from Dr. Pinnati's side. Now he is getting rejoining. Meanwhile, okay, Dr. Pinnati has rejoined.
Sorry, I got disconnected. Can I start again?
Yeah, sure, Doctor.
Sorry for that. And can the organizers share my slides, please? So should I start from the slide?
Yeah.
One?
Yeah.
Yeah, thank you. To present the abstract 5285, which is basically the molecular targets in salivary gland cancers, a very comprehensive genomic analysis of the 1,660 cases. Next slide, please. So these are the disclosures from the presenters. Next slide. So salivary gland cancers are a rare tumors of the head and neck subtype, and these include a wide group of malignant neoplasms and variety of histological subtypes and genomic alterations. And they can range anywhere from a benign tumor or low-grade tumor that requires only surgery and no adjuvant treatment, to high-grade cancers, which are usually treated with surgery followed by adjuvant radiation. And those salivary gland cancers which are metastatic and those are not available for local treatments can be subjected to systemic treatments based upon the tumor and patient characteristics. And while we are considering for systemic treatments, I think in the most of the solid tumors, the trend is to try to identify a genomic sequencing analysis and try to identify targetable mutation. Thereby, we can provide a much more scientific way of treating things which are with a lot less side effects. And this was the objective of this study. Next slide, please. So this was a retrospective observational cohort study that included patients with advanced salivary gland cancers. And this is basically Foundation 1 database. And very rare subtypes of frequency less than 20 types, 20 were actually censored. Coming to the molecular techniques, they have employed the DNA extracted from the tissues from the advanced salivary gland cancers. They are subjected to comprehensive genomic profiling.
Foundation 1 CDX assay was used, and basically genomic bait set of 324 genes were analyzed for substitutions, insertions, copy number alterations, and rearrangements. Apart from that, they also tried to identify the tumor mutation burden as well as the PDL1 expression, which is determined by the DACO 22C3 platform. Next slide, please. So in overall, this is the distribution of the various histological subtypes. The most common type is the adenoid cystic carcinoma, followed by the salivary ductal carcinoma. The rarest of them was the basiloid carcinoma. Next slide, please. So this is the summary of the clinically relevant genomic alterations in the salivary gland cancers. If you look at the tumor mutation burden and PDL1, we can see that the highest percentage was seen in the mucoepidermal carcinoma, 16.9, as well as in the high-grade carcinomas at around 18.3%. And basically, the PDL1 high was also seen in the similar subtypes at around 4.2 and 6.3% and 8.9%. Apart from that, the most common genomic alterations was seen in the cyclin-dependent kinase 2A and 2B, which was seen in nearly 52% in mucoepidermal carcinomas and around 32% in the myoepithelial carcinomas. Next slide, please. So these are summary of some of the targetable genomic alterations in salivary gland cancers. We already discussed that tumor mutation burden was pretty high in those patients who were having basically high-grade carcinoma NOS and as well as the mucoepidermal carcinoma, 16.9% and 18.3%. Moving on to the Fgfr mutations, it is around 11.8% in the pleomorphic adenoma, and also in the pleomorphic adenoma, there are high percentage of patients with the HER2 expression amplification at around 20% in the salivary ductal carcinoma as well as in the pleomorphic adenocarcinoma. More interestingly, the PIK3CA mutations were seen in nearly 1/3 of the patients in the salivary ductal carcinoma at around 32.6% and 1/5 of the patients in adenocarcinoma NOS. And we can see that other much more commoner subtypes like adenocystic carcinoma and mucoepidermal carcinoma are also seen around 9 to 15% of them also show the PIK3CA mutation. And the other rare mutations like BRAF, RET, and BRCA2 mutations are range from 3 to 5%. Next slide, please. So this is basically overall conclusion. This is a very large data set of this rarer salivary gland cancers. This provides the information that there are opportunities for immunotherapy as well as the precision targeted therapy in these cancers. The PIK3CA mutation was seen in nearly 1/3 of patients in salivary ductal carcinomas and high-grade NOS, basically 21.3%. The one of the PIK3CA mutation that can be targetable with a drug, which is alpelisib, can be a consideration for these cancer patients. The ERBB2 amplifications, again, seen in nearly 20% in the pleomorphic adenoma and ductal cell carcinoma. Basically, the anti-HER2 therapies can be an option in these patients' management. Coming to the limitations of the study, it's a retrospective data set. It has its own confounding factors that can be associated with the retrospective data set. These are all percentage description of the mutations. There is no information regarding the treatment as well as the clinical outcomes and survival for these patients. However, it provides an opportunity for future directions. It provides an opportunity for hypothesis generating data that is out there, basically trying to find out a targetable mutation, try to match some amount of treatment with the targetable mutations and taking it forward in the future clinical trials. Next slide, please. So that will conclude very brief discussion of this abstract. Thank you for this opportunity. Thank you. And over to the organizers. Thank you very much.
Thank you, Dr. Rakesh. It's a really nice presentation of a very rare tumor of head and neck carcinoma and very elaborative information. So thanks everybody.